Alrighty, folks, it is Friday already again, and I have Enzo here with me. Hi, Enzo.
Hey Richard, how's it going?
So we got some fantastic news for you guys. We have some Ti bar or titanium bar multi-unit connections, which are finally possible for the laboratories. And I'm going to take myself out of it because Enzo is the expert with InCadCam. So I'm going to have him share the screen, take over, and then I'm going to monitor some questions. Maybe I can be helpful there. And wish everyone a happy Friday so far.
Well, thanks for the expert, Richard. That means a lot coming from someone like you. But yeah, as always, well, thanks for the opportunity to be talking here. Now we are working even closer than we were before. Now that I'm with Auckland and also with InCadCam. All right. Just before we move into the titanium strategy itself, or what's possible, what's not possible, what are the next steps for it, I would just like to do a quick review on what is InCadCam, what's the relationship between InCadCam and AG, where can we use, what other materials besides titanium is possible to work with InCadCam, right? So we go ahead here. So we have this quote here with InCadCam, and I think now with titanium it applies even better, is that InCadCam wants to provide you new possibilities, allowing your lab or your clinic to increase its in-house milling capacities. We like to say that because we understand that if you're going with gearbox equipment, you are going for quality, you're going for flexibility, you're going for reliability, and we want to increase even more your milling capacities, right? All inside the gearbox environment. How do we do that, right? And it's important to understand that this works for any material. The idea is exactly the same. If you're milling zirconia, if you're milling sintron, if you're milling wax, if you're milling titanium, if you're milling PEEK or PMMA, the idea is the same. InCadCam is a milling strategy that is activated on the match to download, right? So it's activated on the nesting software from your gearbox equipment. What this strategy does, it activates a kit of special burrs that will allow you to mill better interfaces, meaning better implant connections or better MUA connections, and also it's going to allow you to mill better screw channels. And when I say screw channels, I'm also including rolls and screws and power balls, that I know is something that is becoming more and more famous here in the US. What we also offer is the possibility to work with our specially designed libraries. And what we always like to say is that different from most other libraries, InCadCam's libraries, they offer you the possibility to mill your own scan body, right? And what is the big advantage of milling your own scan body? You don't have to rely on shipment. You don't have to rely on the manufacturer. You have the flexibility to mill them in the house, as many as you need. You will always have them in 20 minutes if you need one ASAP, right? Here are some of the brands that we work with regarding libraries. And what I like always to say is that if you don't find the library that you need, meaning if you are working with a different type of implant that only you use, or it's not on our developed lists yet, we can always develop the library for you. All you have to do is you're going to send us the analog, the abutment, and the screw, and we'll be able to develop that library within 30 days, right? I think that's a really important feature, especially because we're giving you the flexibility to mill scan bodies for all of our libraries, right? 100% of our libraries, you're going to be able to mill your own scan bodies. Just before I move on to what softwares they work on, it's important to understand that we have two different types of libraries, right? We have what we call the lab scan body libraries, and we have the intraoral scan body libraries, right? The lab scan body, you're going to have the scan body file for you to mill, and you're going to have the implant library for you to design in the case on InCadCam or Zirconia or 3Shape, right? When we're talking about the intraoral scan body libraries, you have the scan body file, right, which is the STL, so you can mill it. You have the implant library, of course, for you to design your crown, your bar, your bridge, your full arch. And you also have the digital analog library. So when you 3D print the model, you already have the placement for the digital analog. One question that always comes up at this point is, am I going to be able to mill the digital analog? No, you're still going to be working with the original analog. All you're going to have is that the file to generate the placement for that digital analog on the 3D printed model, right? As I was saying, all of our libraries are compatible with Zirconia, InCadCam, 3Shape, or Dental Wings, right? What is important to mention is that, sorry. You will also have the option to work with angled screw channel using InCadCam, right? But angled screw channels are only available for InCadCam and Zirconia. This is a little bit tricky to understand because InCadCam itself, the strategy, is related to Match 2, meaning the nesting double, the nesting software, right? While the libraries are related to the CAD software, and the libraries you have to have Mine, InCadCam, 3Shape, for Dental Wings. For InCadCam itself, the strategy, you have to be using Match 2, and I'm going to give a quick equipment. All right. Oops, sorry. So talking about the burrs now, just keep in mind that I'm going to be talking first about the soft materials. So Zirconia, Syntrum, PMMA, wax, PEEK. And then at the end, I'm going to be talking exclusively about titanium, right? So for the soft materials, we have three different burrs. We have the 0.6 ST, we have a 1.2 ST, and we have a 1.5 3Shape, right? The 0.6 ST is the burr responsible for milling the interface itself. So it mills the connection. The 1.2 mills straight screw channels and the screw stop. And the 1.5 is the one that's going to be milling the angled screw channels, right? How to position those burrs on a tool holder, right? Of course, if you have a Matic or if you have a Motion 3 now, you don't have to worry about where you place the burrs because the tool management is done automatically by the RFID system that both machines have. But if you work with a Motion 2, Motion 1, or Micro 4-axis from a Mangiva, it's the blue holder here, right? So you have six positions. You're gonna have one position for the 0.6, on position 5, either the 1.2 or the 1.5. And you're gonna have on position 6, the 0.3 HD as you usually have. On a Micro 5-axis, you have the 0.6, on position 5, the 1.2 on position 6, and the 1.5 on position 7. What is important to understand here, those burrs, though, they're not replacing the traditional burrs, the standard burrs that you have today. The difference between those burrs, the ones that you have today, and InCadCam's burrs, that InCadCam's, they have the flat top. And I'm going to show you in a little bit what is the big difference that having a flat top burr can make. Here's what I was talking about. So if we look, these both cases here, they are exactly the same STL file, right? The only same STL file, same nesting software, same designing software, same library. The only difference between the one on top and the one on the bottom here is that the one on top was milled without using InCadCam, and the one on the bottom was milled using InCadCam. And here you can already see what is the importance of having those burrs, right? So on the interface here between the implant and and the crown, the abutment, whatever you're milling. If you don't have InCadCam, you're going to have these gaps. And as important as these gaps you have here on the screw stop. So you can clearly see if you don't have InCadCam, you're going to have these gaps. What these gaps going to end up doing with your construction, you're not going to get a good adaptation. If you don't have good adaptation, good fitting, you're probably going to have micro movements. And with micro movements, you're going to end up losing the restoration, right? While when you work with InCadCam, you see that the finishing is way better because you're using the flat burrs here, right? I know this is not going to be the main focus of InCadCam for the US. I'm going to talk a little bit about how the FDA works, understands this. But if you're milling custom abutments with InCadCam, again, those are exactly the same STL files. So you have on the right here a hex connection milled using InCadCam, and on the left here not using InCadCam, and the picture here speaks for itself, right? Just before I move on to which equipment you can use InCadCam with, I want to talk to you guys a little bit about how the FDA understands if you can or if you can't mill custom abutments, right? If you can mill abutments like this. Basically, trying to summarize it, if you are a clinic, so if you have a clinic with an in-house dental lab and you have a dentist signing it, you're able to design and mill custom abutments. If you are a dental lab, to be able to produce custom abutments, then you have to have a 510K license, right? Now moving on to the material, to the machines that you're going to be able to work with when using InCadCam. Basically, as InCadCam is a partner of Gearbox, our solution is exclusive for Gearbox equipment. So for the Medic, for the Motion 3 now, Motion 2, Micro 5 axis, Micro 4 axis, even if you are one of the lucky ones that still have the Motion 1 running, it's going to work on that as well. So what materials before you were able to mill, what materials can you mill soft materials with InCadCam? Syntron, Zirconia, wax, PMMA, right? But now let's talk a little bit more about what is the really big news here. So everyone that has a Medic or anyone that has that has thought about purchasing a Medic has always wanted to mill titanium, and the strategy is finally here, right? And what is the big thing about the strategy? The way it works is if you want to do crowns and bridges or bars bridges over TI bases, so if you want to do them glued over TI bases, you don't have to have InCadCam, right? So with the 4.2 version of the Ceramil software, you're going to be able to design crowns and bridges over TI bases straight with the Ceramil software as it is. But if you want to mill screw retained bars, screw retained bridges, so meaning on top, directly on top of any waste, you have to have InCadCam for it, right? And we are forecasting to deploy a angled screw channels for titanium on the next upgrade on the 4.3. But what is the big advantage of milling titanium in-house? Again, bringing flexibility to the lab, so you can make your portfolio of products even bigger. It is a way, how do I say that? It is a really profitable type of work. It is expected that you can have up to 60–70% of margin when we take into account all the costs of producing one bar in-house and how much you would sell it to. Sorry for that. So again, let me reframe this. Let me say that again. If you want to do crowns and bridges on top of TI bases, so if you want to do that cemented glued, you don't have to have anything besides what you already have. on the 4.2 serial software. But if you want to mill screw retained bars and bridges, then InCadCam is there for you. All right. So basically now what can you do, what you're going to be able to do once you have InCadCam? I'm going to say first as a clinic, so as a clinic with an in-house lab, or if you are a lab with a 510K license, what are you going to be able to do? You're going to be able to design and mill custom abutments, produce your own scan bodies with in-house technology, mill angled screw channels. So basically what InCadCam gives you is more flexibility to work, especially with screw retained indications, right? So if we think about it, the way AG positions their equipment today, you're able to do a lot of cement and a lot of glue. But if you want to move to screw retained cases, then you go with InCadCam, right? Now, if you are a lab without a 510K license, what are you going to be able to do using InCadCam? You're going to be able to design and mill bars and bridges over anyways, over any type of component that is FDA approved. Meaning, if you have, for example, a all-on-4 case with 4 MUAs, and you want to screw retain directly on the MUAs, you're good to go without a 510K. But if you want to do direct to implant, then is when the 510K is required. If you guys have any questions, any doubts about that, please contact us. We can run through the whole thing and explain the whole interpretation. All right. Now let's go ahead and let's talk a little bit about some examples, some real cases that were milled using InCadCam. I like to show this. It's really simple, but when you see it, when you can grasp what are the advantages of being able to mill your own skin bodies, I think it's really nice to show that. So this is just a simple case with 6 skin bodies milled out of PEEK on a motion 2, if I'm not mistaken here. It's either a motion 2 or a microfiber system, right? But again, all skin bodies milled in-house. Each one takes you, I don't know, 12, 15 minutes to mill. It gives you a lot of flexibility, right? You don't have to be constantly worrying about stock management. You're always going to have them on the go if you need. This is what we are launching, what is now possible with the Medic, right? So we have here a titanium bar with those, I don't know if you call those attachments or if you call those retenters, but what is the idea? Full titanium milled with an in-house milling lab. All of the cases, all of the strategy was validated using the Schaffner test, Schaffner, I don't know how to say it, but it is a test that validates the precision of the adaptation of the case once you have, after you mill, right? So all bars were ran through that test and they got an acceptance criteria on it. So here is one bar, let me show you a different one. Again, this is a titanium bar fully milled on the Medic, right? And I want to just zoom in here a little bit so you guys can see what is the screw retain that we were talking about. So this, if you want to do this, if you want to screw retain your titanium bar directly on top of the MUAs, like this case here, then you have to have InCadCam performance, right? Now going back to the more traditional usages of InCadCam, we have here a Zirconia bridge, all in GenX, screw retained directly to the MUAs. Here we have a all 1, 2, 3, 4, 5, 6 Zirconia case using solid HT plus. Again, screw retained directly to the implants platform, not the implants, directly to MUAs. Sorry. And here's one I always like to stop here and kind of go through the importance of choosing a good zirconia when you're doing those big cases, right? So if you are doing a full arch like this one, and you want to do that screw retain, even if you're using a rosin screw, for example, you have to use, how do I say that? Zirconias that have more strength, meaning you have to, on the Amon gearbox line, you have to go either Gen X or above. So Gen X, HT, HT plus, or the ZI, right? It is not recommended to do a screw retain case on a solid FX multi-layer, for example, right? Because it doesn't have the strength to hold up the screw. Here is just to showcase what I was talking about, the angled screw channels. Just reinforcing angled screw channels right now, what they're available for. They're available for zirconia, Syntron, wax, PEEK, and PMMA, not yet for titanium. What we are trying to deliver is for the 4.3, meaning for the next upgrade of the serial software, that you're going to be able to mill titanium with angled screw channels, right? Here's another case, full arch here, all on 1, 2, 3, 4, 5, 6, 7, 8. Same idea, directly over the MUA, no metal, no cementing, all screw retained, right? And here, just a final example of a PEEK structure. So same idea, no abutments, no TI basis, sorry, not no abutments, no TI basis. You're doing screw retained PEEK structure on top of the MUAs here, and you have the crowns done on solid FX, right? A final case here. Sorry, I thought that one was the last one, but this is a case done by Nondas, a Greek ceramist. So he designed a Syntron bar on the bottom here, and now we could be thinking about this as titanium. So metal bar on the bottom, zirconia superstructure on top. Then you cement one on top of the other, and here again, all the connections milled by using InCadCam's strategy. Okay? And here's just the final case, so you can see the aesthetics of it. All right. Just to give you guys a little bit of a better idea of where InCadCam is around the world. So we are now actually closing to over 1,000 customers. We are in 50 different countries. We are with 60 different distributors. But what is really important, in the US, the only distributor that we work with is Opulent, right? And here's just a little research that we did within our customers to try to understand where and how and what are the possible issues that they had when working with InCadCam, right? So we interviewed all of our installed bases alongside AG. Okay, so this survey was ran alongside Amon Gearbox, in partnership with Amon Gearbox, sorry. And we asked all of our customers, and we asked them, okay, how many units you milled using InCadCam? And from those and out of those units, how many were zirconia? How many were crowns? How many were bridges? And how many did you have any sort of issue with? So did you have any problems? Did you have any, I don't know, any implant loss, any fractures on the restoration, right? And what we got as a response was really amazing on our side, because, let me read it out to you. So out of 30, let's say 35,000 units milled using InCadCam, only 113 showed any type of issue. So that's a 0.32 complaint rate, right? And out of those 113, we didn't see any fractures of the abutments or the restorations. And we didn't see any loss of implants or health problems for the patients were observed. So no loss of implants or health problems of the patients were observed. No fractures of the abutments or the restorations were observed. What was the issue that popped up the most? Screw loosening, right? So it was you screw it and then the screw is not tight enough, and we know this can vary. This can have a lot of factors on it as well. Just out of curiosity, 62% are using for single grounds, 38%, so let's say 60-40 are using for multi-unit bars and bridges. On the bars and bridges, we had 50% zirconia and 25 Centrum, 25 wax. And now what we expect with the launch of titanium is that the number for metal increases and increases even more. Right? Richard, that's what I had for today. I don't think we have any questions here on the chat. So if you wanna jump in, ask us any questions. If you don't, thank you for your time again.
Awesome. Yeah. Thank you for doing that, Enzo. So let me repeat this because this is big news. We can basically now, as a laboratory, make titanium bars on the Matic directly connected to MUA. We've been waiting for that for quite a bit now, and we're able to do it. Zirconia was one thing, but I think some people, especially in the US, are a little reserved on the usage of zirconia directly connected. I've actually now seen several cases, and I changed my opinion a little bit about it. And I guess everybody knows these cases to be working and very strong, etc. Titanium, lightweight. So this is super exciting that we finally have that. That is so cool. I'm really pumped.
Yeah, it's been a lot of work. It's been a lot of work to deploy that. Especially with the R&D from, we had a huge help from the R&D team from Amanduba. And I know I'm biased to say, but the strategy is really good. It's been tested a lot. It's been proven a lot. It's been verified a lot. And the results are really, really amazing, even when compared to other mills.
Yeah, I love that.
So yeah, in summary, now if you have a Matic, either if you're a lab or if you're a clinic and you want to do screw retained bars on titanium, you're now able to do so.
Do you have, by chance, an approximate milling time for a bar like that, what we're seeing on the screen?
For a bar like this on the screen, how do you call this bars? Is it thimbled?
I want to say that this I would call a thimble. The other one were more like retention pins. Yeah.
Okay. Sorry. For a thimble bar like this, if you use the high definition specs, we are talking about 9 hours, 9-ish hours, okay. 9.5 to mil. Yeah. And for a bar with those retention pins here, we're talking about a 4 or 5 hours now.
Okay, very cool.
Yeah.
Very cool. So that one doesn't use that's just a standard strategy for the retention pins there.
Sorry.
That's basically the standard strategy, not the HD for the retention pins.
Yeah. Okay. When you're doing retention pins, just use the standard. Let me see if I can find one picture here. Give me 1 second. I always like to show that. It's important to understand what is the difference. Give me 1 second.
Yeah, good stuff. I like it.
So this is what we show.
All right.
So if you're doing a titanium bar that has those little holes, I don't know how you call those holes, but they are for you to place the retainers. You know, when you do a removable, how do I call this? And then look.
Oh, I see what you're saying. Okay, so you're screwing basically locators into those, I would assume, right?
It's not a locator. It's I don't know how to really say that in English. I'm doing my best here. Yeah. So it's when you have, for example, you have the metal structure here, and then you have those little golden pins that you put on top of the structure, and then you place the case, and it's kind of removable.
Yeah. And then those retention pins, I think they're what you're referring to are locators. I've also seen another really cool thing, and I'm excited if that maybe becomes something of the future at some point, where I don't know how difficult that will be with the strategy to mill a thread, a screw thread. I've somewhere seen a
Yeah,
picture floating around where basically you had a Moa bar, an offset bar like this, very simple design, with a slight taper on it, that it didn't even need like retention or anything on it, and then basically screw access holes milled straight in all basically the same path insertion in there. So the point of the whole ordeal was that you can still screw it together. It doesn't have to rely on cement. You can take it out. The bar stays in there, but the bar is helping you to straighten out all your crazy implant angles.
I see. Yes.
Yeah.
There's one company I've seen doing something close to that. I think it's an Italian company called Ancorvis. And Curtis, if you want to take a look into that, it's they're doing something on that on that range.
That'd be awesome. I'm definitely going to take a look. Shoot me a link over later. And I don't think otherwise we have questions here. So thank you very much for your time and being on here. And we will keep you guys updated once, I mean, it just came out, once we have more pictures and videos and stuff and people using it. We will collect those and maybe make a follow-up. And in the meantime, go to our website or email us at Enzo or Richard at InCadCam.com if you have questions. And we'll prep for the next time. We'll send you an email reply.
All right.
Perfect. Then everyone have a great weekend and see you next time.
Thanks for the opportunity and see you next time.
Recording stopped.